Can you hear me?
Hello, good evening, everyone. Welcome to our Zoom session. As usual, let's start our Zoom meeting with a silent prayer. Good evening. Welcome, everyone. And Dr. Sada Seth is already waiting here for the, he's very sharp in his timing. And there is no need of any introduction about Dr. Sada said, because he has taken classes many times in IFPH. He is the part of IFPH. He is the member of IFPH in Ernakulam chapter, and he has given many knowledge to IFPH members. And whenever we call him to take classes, he is ready to take classes. Yesterday night only we informed him to come and take classes. He is ready to take classes for us. Very thankful to you, sir, for your precious classes. And thank you all the participants for joining and supporting IFPH. Today is our 723rd day, and today Dr. Sada said is taking classes about his experience. So I am welcoming Dr. Sadat Seth. Sir, please welcome.
Can you hear me? Can everyone hear me?
Yes, sir, yes.
Okay. Thank you so much for the IFPH to invite me back again.
But it is very feeble. I don't know whether it is for me or everyone. Can anyone else comment, please? Can you hear me properly, sir? Sir, have you heard what I said?
Yeah, I
Is
got the
it clear?
information. Yeah, it's very clear.
Okay, thank you, thank you.
Okay.
Can everyone hear Dr.
Yeah.
Sada Seth?
Yeah, that's information has come
Maybe
already. Yes.
it is because of my network problem. Okay, sir, if everyone can hear, you can start.
Okay. Okay. This is something which I wanted to share is see why this topic. This topic is my experience and treating diseases on the diagnostic approach. Something which is very controversial in homeopathy. Does homeopathy needs to be diagnosed? Once if it is diagnosed, can we treat based on that? Lot of controversies up and down. So I just wanted to share something else. Topic is controversy. Before that, I just wanted to tell you something. Let me first congratulate all the IFPH members who participated in Trivandrum. I couldn't come because of we have been meeting with the legal people here regarding our medical bill. So thank you for everyone to be there, each and everyone. Second thing I wanted to tell you is there is a international seminar on Ayush system is coming up in Trivandrum, November 11, 12 or 13. I'll confirm the dates. We want everyone to be participating. It's 3-day seminar. It's a big one, big event for everyone to meet up, especially international people. So please do join us in Kerala. We'll be happy to host you. QPHA and the press, one of the press group is hosting it. So please do join for that also. Okay, then let me go to the topic. This is very controversial. I know that, but still controversial makes it more challenging, right? Without controversy, there's no fun. So let's start with the treatment aspect. Let's start with the diagnostic aspect. How did we reach to the diagnostic approach? See, majority of the time, what happens is people come to us only with the lab reports. Some will say that my wife wants it, my husband wants it, but he is in Dubai. I say that tell them to call me up or talk to them. But he will be working at today evening. Someone is going send some money, medicine. So this become a routine. Once in a while, the Gulf people come and said, okay, we are not getting his in the job. We are not getting the phone calls to talk to him. So what else to do? They come with some scan report of the hemorrhoids or piles or something diseases, some other diseases. Will be forced to give it. Once we give the medicine, depending only on the diagnosis, not based on the other aspects of the homeopathic prescriptions. Once the patient is better, I'm not saying that fully better or partially better or whatever, the patient feels better, they will call us, they will talk to us, they will send some other relatives. So this made me think that okay, this is also another aspect. When I went through the literature, Boric is there. All the regional repertories of fever, joint, all the regional repertories are there. They basically take things into this view. Another thing is homeopathy has a specialization now in psychiatry, skin diseases. How do they differentiate the medicine? It's based on the individualization of this particular disease. So we know more and more about if it is a skin complaint, we know more and more about the particular disease, particular way of treating it, what is the prognosis. So people get to know most of them. The PGs who do it get the maximum. Is my screen shared?
No, sir.
1 second, ma'am. Let me. Okay. Now I think it's shared.
Yeah.
Okay. We stopped with all the head to foot. Now let's go into the diagnostic aspect. And when the diagnostic aspect comes, how can we miss out the COVID first? That gave me one of the best boost in this world of homeopathy. Yesterday also one doctor from Delhi called me up. The Rajasthan senior doctor who expired today, their family wanted me to treat him. I don't know, couldn't contact him because it was an ICU. They didn't call up, but that is the fame what it gave me when the COVID was there. How did we do that? I even didn't know what was COVID about it, how to go about it. We just took the risk of it. So how to go? COVID, because most of the people call from the ICUs and talk to them. It was like 24 hours per day, the phone was ringing. So what else to do? This fellow is calling, doctor, I have this symptoms on the investigation. What to do? Okay, give this. Another one is same way. So, same way we are getting the calls. So how I went through that, I'll tell you. So investigation comes from COVID, CBC. Most of the cases we saw the thrombocytopenia. Nothing to think and nothing to wait. Immediate. Phosphorus 30, X-ray 30. Even 50,000, 12,000, 18,000 of the platelet count came down. Next day morning, it has shooted up to 20, 25, 30. You continue for 2 days. The thrombocytopenia goes high, gets cleared. These are the medicines. Another one will come up with ESR elevated. COVID is the diagnosis, ESR is elevated. Go ahead. Acyod and tuberculum HS. 100% within 2 days, ESR will come down. Okay. Liver function test. Most of the cases of COVID, liver function test was elevated. We have a wonderful medicines in Calmec. Any liver function test, you sure showed AGSG, SGPT. Now they are confused with the GGT. Whatever said and done, Calmec will take care of it. I used to give it in 15 doses, 15 drops, 3 times a 4 times a day, 10 drops 2 hourly. That depends upon the severity, but Calmec is a sure shot for the LFT to clear up. Tincture also is possible. 30 also, if you have it, give it. Picric acid is another one medicine which is very good for the jaundice with when COVID was there. Chelidonium, Chionanthus. These 4 medicines have cleared it almost every case of This one, D-dimer. D-dimer was one of the sure shot. 5,000 D-dimer. I think I had taken a class on COVID. There I showed you because I had to go through all this. That's why I didn't put up all the cases. D-dimer, nothing else. More than 2 medicines is more than enough. Whatever the 5,000, we brought it to 500 in 2 days. Phosphorus and Crotalus horridus. Troponin. Troponin is a heart enzyme, which will be high in the case of COVID. If there is a COPD and the cardiac involvement along with the COVID is there, then adrenaline and cactus and critiagus. These three medicines have brought down the uh, troponin levels to the normal. I'm not talking about just a COVID. It was the case in 99% of the cases. So I'm talking here is they were in ICU with ventilators. I had shown you 10, 12 cases with a severity for one month from each segment a few months back when the COVID was there. So I'm not repeating that back again, but these are the medicines which we should lactate, this one, hormone, LDH means muscle pain, body pain, lactate dehydrate. LDH is not the LDH is a indication for the muscle breakage. That is muscle involvement, even the heart involvement, heart muscles involvement, skeletal muscles involvement. We have a wonderful medicines, natron salicylicum, sarcolactic acid, phosphorus, macrotin 30, which is available in the this one in the boric. Ipetorium vanam, gelsemium if there is a backache involved, belladonna vanam, Restox. I don't have to tell the Restox and natron salicylicum and sarcolactic acid. Sarcolactic acid is one of the best medicine for the muscle pain. Sarcolactic acid is another one of the best medicine for body pain after influenza, pain after influenza. So it's beautiful and it's one of the best stuff for the homeopathy. Ferritin was another this one. Again, it also related with the body pain. Bryonia and phosphorus 30. If the ferritin was high, even now, COVID is still there in Kerala. At least once in a week, I get patients. So phosphorus 30, bryonia, creatine kinase, another one which we never knew all these days before COVID. Honestly, I didn't know. Because we used to hear about it, but what was the significance, why it is done, we never knew. So creatine kinase, again, is an enzyme protein. It is called an enzyme, which is more marked in the skeletal systems, everything. That's why bryonia and epitorian comes up. Okay. And treatment on the basis of X-ray. They just send the photo of the X-ray and send it to the WhatsApp. What else are you supposed to do? CT scan report, they send it to the WhatsApp. There's not even a minute to talk to them because next call is on the wait. That was a situation we all faced. I don't know, majority of the doctors must have faced in Kerala, even though after government has what to do, what to tell you, it was such a rubbish decisions. We overcame it and we have done a much better stuff. So bryonia is another one. If there is a hourglass or what is that? Glass kind of a appearance. Broken glass. Nowadays the car people get it. So bryonia tincture, Senega. Senega is a wonderful medicine. Without Senega and bryonia, we would have lost the game. At least I would have lost the game. That was the medicine which helped me throughout and saved the people. Okay, Grindelia is another cough and night cough. If they get it, Grindelia was the medicine. I gave it in a tincture form. Aspidosperma tincture. You all know what was aspidosperma all about. Aurelia, wonderful medicine if the cough and is associated with the dyspnea, even in the COVID time. So how to discriminate, how to individualize, depending on the more the intensity, more the Bryonia was Bryonia and Seneca was indicated. Lesser round count comes up the Aspidosperma and Aurelia. That was the only thing I could even think about it. That was the frequency. Okay. And based on the symptoms, COVID, if you get the symptoms, fine. If you can't, you don't know. So throat infection is always there with the COVID. You don't have a time to discriminate, individualize. So Phytolacca decantra, Belladonna, Baptisia, and Hepacil. This was the three, four medicines which cleared. Vaitia. Vaitia is another one of the best medicine which I couldn't add it. Vaitia. SpO2 low. Carboj, vanadium, aspido. Sure shots. Most of the cases, this has helped us. And you know the lab investigation for the COVID to diagnose the COVID, CBC, CRPC, LFT, D-dimer, CKMP, troponin, LDH, ferritin, serum amyloid, X-ray, and CT scan. Okay, nothing much to explain it on it. Please go through the books. You will get everything in the books. How, what is LDH, what is ferritin, and what everything. There is no time for all that to be explained here right now today. Okay, so please go through this. This is something which will be useful again. It is still there. Okay, so COVID, I even thank COVID now is because it made me what I am today. PCOD, that's one of the best and homeopaths treasures. Homeopaths, what are called gold mine. PCOD is a homeopath doctor's gold mine. Infertility, Dr. Shanta, Dr. Rema, everyone. This is one of the gold mine we get it. So everyone of the homeopaths, even the juniors just started. It's one of the best. So start giving it PCOD and PCOS, blood routine examination, fasting blood sugar, PPBS, total cholesterol, HDL, HDL. People come with the scan reports, USG abdomen and pelvis, enlarged ovaries, increased size 12 or more follicles with 2 to 9 millimeter of size, and hormonal study. Testosterone. This is often the initial test to determine whether you are producing excess androgen. The level is usually elevated with the PCOS. Okay. And the medicine is cortisol, testis, and testosterone. Simple. The medicines we can cortisol 30, testis 3x or 30, and testosterone. Okay. These three medicines can help you bring down the testosterone levels to an extent. And taking of the cases is a must that I will explain it to you how to go about it. Sex hormone binding globulin. If you just get this lab report alone, maybe reduced in PCS. Again, testis. Testis is one of the best medicine for the sex hormone binding globulin if that particular lab report is high. Okay, and anti-Mullerian hormone, an increased level is often seen with the PCOS. Anti-Mullerian testis and tuja plus pituitary. Okay, pituitary is one of the medicines which can bring down the levels. If we can bring down the levels, and if you have a patient is okay convinced, okay, one sitting and 1 week or 2 weeks medicine, all this 2-3 this anti-Mullerian hormone is coming down. Patient have a faith in us, they will stick to us. Luteinizing hormone will be elevated. Luteinizing hormone 200. Again, tautopathy, tuja, silicea, folliculinum. This can bring down the luteinizing hormone to a normal level. Hello, who's that? Follicle stimulating hormone will be normal or low with PCOS. Thyroid stimulating hormone to rule out a thyroid disorder. Thyroidinum, calcareoid, fucus, prolactin. Is it from my side? Prolactin to rule out the elevated prolactin. Borax and pituitary. Borax is one of the best medicine for the, if there is a level of, can someone mute it, please? Is it mine? Okay. Prolactin, if it is more, borax is one of the best medicine, and pituitary is another medicine which can bring that bring the prolactin level normal within a faster level. And you know what should be done. Treatment approach. There are 3-4 approaches which I do it. There is an organ level, organ specific level, which can go through ovary, follicular, and palladium. Okay, ovarianum is there, follicularnum is there, palladium is there. Endocrinological approach. You know what is endocrinological hormones which will be affected in this. Brain, the medicine called brain 3x is available. Hypothalamus, pituitary, and thyroidinum. These are endocrinological approach. You can give this medicine and bring down that level. Then to cure it, we'll have to go for the lab investigation, which I told you. Symptomatic approach. If there is anything which you can get it while taking the cases, go for the symptomatic approach. And these two things are very important. Miasmatic approach and constitutional approach. Miasmatic approach, mostly the psychotic symptoms will come up, but there is a confusion if you take up the family history, if you take up the patient history, and if you take up the symptoms or where the patient stands, what are the symptoms, how long the symptoms are there. Depending all that, you can suggest, you can take down the miasms. Miasm, mostly it could be syphilistic. And if there is a carcinoma history, go for a carcinosin. Again, 1 dose of carcinosin will clear up the cases, and go for the constitutional approach. Without constitutional approach, a miasmatic approach, is very difficult for you to treat PCOD. Okay, all the other things which I've told you will help you control the lab investigation to make you happy, the patient happy. Once the patient is happy, they will stick with you for any long time of any time you want it, and go ahead. Okay. Next is varicose ulcers. You know what are the medicines? Most of the medicines which come up is acid chlor, vipera, Cicalcor, carbamide, silicea, lacasis, and Merxol. Most of the cases will help you in getting rid of this. Case taking, again important. If you can get it, well and good. If you can't get it, you can't help it. You should not stick. You should not leave that cases because I have not got anything. We have got one symptom or one lab investigation. We have the scope. At times we don't get anything. Patient's relative come and tell you, doctor, this is the report. Doctor, this is the report. What to do? We'll be helpless. Check out for the lab investigation or whatever he has to say. Listen to that person. Mostly lab investigations, scan reports will come up. There will be one thing which homeopaths can think about it. We can even at least prescribe in the common symptom, which is not the proper way of doing things. I'm 100% I'm telling you. But this is another approach where we cannot afford to lose that patient to those who are coming from allopathy or any other system to homeopathy. Okay. So this is varicose vein. Another pulsatilla and gunpowder. Gunpowder is another one. Anthracinum is also one medicine. Arsenic album is also another good medicine. So this is the approach. I'm talking about diagnostic approach of varicose vein. These are the medicines can help you out. And you know, no, acidity. Acidity is a GERD, GERD. You know all the medicines, Kali bike too. Every lot of things. Atropine, you can think about it. Argenta nitricum, you can think about it. Kali bike. These things will bring the acidity level 100% less. Patient will feel 100% better. Then you take the case in detail. If the patient comes to you next time, or patient ask the patient to come down, you cannot just treat it. You can give these medicines and make him better. Once he's better, tell the relative or bystander or whoever comes with the report or comes with the symptom, tell him to come next time that you wanted to see. Nowadays, things are done in the phone. COVID time, we never had the chances of seeing the patient. At least majority we couldn't see. They were calling up, they were coming with the this one. Rectum. Today I had a patient. Rectum, there will be three things which comes up: fistula, fissure, and hemorrhoid. You have to diagnose. You have to do a rectal examination. I don't know what to tell you because majority of the clinics doesn't have an examination table. Even if they have it, it is done. It is kept for the all our throw away things to be stored on that, kept on that. So please do have a this one. Today also I had a patient telling that I told him clearly, this is Fisher, Fisher. Examined him with rectal. I examined him, told them it is only Fisher. Okay, so he was not convinced. He said, "No, doctor, I have that, this." I said, "Okay, for me, it is 100% convinced. It is a Fisher, not hemorrhoids or fistula." Still, he went into bigger Aster Hospital in one. Cochin is one of the multi-speciality hospital. When their gastroenterologist, even he put that what called proctoscope, he couldn't enter it. The moment that proctoscope didn't enter it, he said it is fissure. Fistula is not the one which can stop you from entering the proctoscope, neither the what called hemorrhoids. The moment he went there, we could tell him that it is fissure. Then he came back today. Doctor, he also told it is fissure. Now I said, this is what we tell you. Listen to us. You wasted your money. That's all we can tell you. Okay, so please do diagnose. Please do physical examination. Have an examination table. Every patient enters to your clinic needs a physical examination. Don't let anyone go without physical exam. Okay. Features. The medicines could be plumpum, Condurago, acid nitricum, Retania. We know a lot of other medicine. If the diagnosis is this, give him this. Take the case. Okay. Fistula. Again, fluoric acid, acid nitricum, calendula. How do you do that? Nowadays, that fistulogram has come. You need not do the total MRI to get that. There is a fistulogram. You can do the part. And the medicine and the cost is also less. Okay. It's an MRI. We can get the fistulogram. Fluoric acid, acid nitricum, calendula. If it is hemorrhages, Kalicar, alumina, along with the backache. If this is a backache, cobaltum met, cobaltum not cobaltum nitricum, cobaltum met, zincum met, guaiacum. Guaiacum we never think about it in the fistula. Then pyrogen is there, silesia is there, lot of other medicines are there. Everyone knows it, but this is the way you can think about it in the fistula. Okay. So the approach is total diagnosis. And we this is something which I added as arteriosclerosis. Barretta mure, Barretta iod, plumpum, Kali iod, vanadium. Diagnosis arteriosclerosis. Plaques, block, Merxol is there. A lot of other medicines, the Critiagus is there, Cactus is there. All these medicines can clear that. Take the case in detail. Take the case in detail. He needs to be, his lifestyle has to be controlled. If once you know the diagnosis, all the dietetic manner and all the physical activities, every Honeyman, whatever Honeyman's told, ancillary measures has to be implied here. So this is the arteriosclerosis and on the basis of diagnosis. Hemorrhoids, Aeschylus glabra, mucuna, collinsonium, sempervum pectorium, and Wyatia. Almost these medicines can clear it. And we all know a lot of other medicines. Ruta is also there. Retania is there. 90% of the concept, yeah, it can clear it. Aesculus glabra, Aesculus, lot of other medicines. So that on the basis of the hemorrhoids, these are the medicines which came up in my mind. I just wrote it down. These are the medicines you can think about it. Other than all the routines. Acid nitricum, Mercor. How can we forget those medicines? If we have the symptoms. And there's one the gallbladder stone, Chionanthus, Diascoria, and Chionanthus, Diascoria, Cholesterinum, Peltori, and the endless lists are there. But differentiate. If you have to give Peltori, you can even think about if you have the chance to ask him whether he sleeps even just after the food. That one single indication will lead you to Peltori. Okay, every medicine has an indication, differentiate or individualize. If you don't have the time or if you don't have the facility or don't have the patient in front of you, don't have the circumstances, this can help you bring down the symptoms. Okay, gallbladder, you know, every lot of medicine. I've told you that in the last few cases of apple therapy and all the other medicines have been explained. Adenoids. What else? Propylaria, Soranum, Agraphis nutans. Lot of other medicines. And this is something which aglectia. What is that? It's the lack of milk. For me, whatever sedent, resinus, thyroidinum, lactuca virosa. Lactica is not lactica virosa. It is written by the junior. It is lactuca virosa, 10 drops or 15 drops. Majority of the female doctors can help try it out. Or now everyone gets it. For delivery and the baby is not getting the proper milk because of the lack of production of the milk. Lactuca virosa, read. Aphonia, 90% of the doctors gets it. 90% of the doctors get this kind of a simple. Everyone gets it. Aphonia. Manganum, Epitorium, oxalic acid, Argentum metallicum, Hepacil, Cocculus, Verbascum. Verbascum, if there is a causative, okay, Verbascum. And for the aphonia, if you get a causative factor, go for that. Don't go for the common medicines which I've told you. Go for the if there is any particular cause for the aphonia, getting wet, or if it's a singer, if it's talks, if it's a person who gives speech, go for that. But if that is what called individualized. Take the case if you have the chance. Don't rely on don't stick with what was rest. If you don't get any of the things, don't lose that patient because you don't have that individualizing symptom, or you how can you take case? Nothing. Anyway, we have to reach to the patient. Arthritis, osteoarthritis, cracking, benzoic acid, graphitis, angustura, petroleum. Petroleum is one of the best medicine for the osteoarthritis. Then you know the guaiacum, painkillers, a lot of things. If there is inflammation, this is osteoarthritis and this is arthritis. If there is a pain or any inflammation, colchicum, bryonia, guaiaca, stellaria, rustox. Medicines are there. OAN, osteoarthritis nodosa. Most of the people say that you don't get results, but if it is repeated properly, even the cartilage damages can be also be cleared, at least reduced to an extent. Okay. And most of the time people we get it. High uric acid, normal value is 3.2 7.5 milligram per deciliter. Benzoic acid, cajaputam. Cajaputam is one of the best medicine for the gas formation also. That is belching and flatulence. Cajaputam, colchicum, uric acid, formica rufa, guaiacum, lithium carb. Fixed medicines are enough to, if you get a results of the pain and that toe plus no high uric acid. What else you want? Give this 100% or at least 80 to 90%. You can get the, you can bring down the level. Then take the case. Ask the patient to come down and take the case in detail. Synovitis, Epis, Bryonia, Ruta. Nowadays, this is also more. Rustox, because of the athletes. Athletes, most of the people get it. Ruta, Rustox, Stellaria. Backache. The first and foremost medicine which comes into my mind is cobaltum. And this is totally researched in at least minimum of 500 patients by Dr. Jairam and confirmed it. Okay. Cobaltum, strychnine, Rustox, Berberis vulgaris, cannabis. Cannabis is one of the best medicine thing you can think about for the backache. Helonius. Helonius has the female who is a chronic backache lady. Helonius, morphine, Nexomica, hypericum, if there is a nerve involvement, variolinum, then you know a lot of other medicines, Kali bike, to every medicine. Barber's itch, most of the people get it after shaving or something. Graphite is carbolic acid, sulfur iodatum, carboanimalis. Okay. Bell's palsy, almond phosphoricum, Kali bike, cauliflower, causticum, Senega, not the Senna, it is Senega. Okay, a little correction required because it was the faster way of doing yesterday only people told me. So slight correction is required. It's Senega, not Senna. Then comes the biliary calculate. Chunandus, Cardus, Diascoria, Hydrangea, Calcareca, Juglans Syria, Peltori, Berberis, Nexomica, Colosin. What else you want? How many medicines you wanted? Hemorrhoids, back again. Esculus, Helonius, Elo, Amanka, Mucuna. Mucuna is again called Dolichos, which is also useful for erectile dysfunction. Okay. Our in colloquial language, Malayalam, it is Nayakornapudi. Okay. Pioneer, Retania, Vaitya. Bleeding per rectum, Polygonum. Bleeding per rectum. Polygonum is another medicine. This is hemorrhoids without bleeding. This is bleeding per rectum, Polygonum, Nexomica, Phosphorus, Ipecac, Ficus. Ficus Atti. That is another best medicine for the bleeding per rectum. Scrofularia, which never think about it. It's a bleeding per rectum. One of the best medicines for this one. And we know that it's one of the best medicines. Xeroderma or fissures or cracks on the hand or feet. Xeroderma is a dry skin, which again may lead to fissures or cracks. If there is a crack coming up, graphitis, petroleum, natron tar, calcarea, sarsaparilla, paraffin. How many medicines? I know. Close your eyes and you can give it. Okay. So these are the medicines. Chickenpox, which we are losing it out now. Chickenpox, variolinum, syrinum, Merxol, antiemtat, Rustox. Again. Take case. If you have that patient in front of you, or if you have any way of taking the case, Google Meet, WhatsApp, however possible, whatever the possibility, you can take the case. You will get the wonders at times. Differentiate, individualize the medicines and give it. Dengue. Again, homeopaths, gold mine, digging, nothing. 2 days, 90% of the dengue will be under control. If it is 12,000 cases, 12,000 platelet also. Again, epitorium, X-ray, radium bromide, carica papaya, rustox, merxols. Lot of medicines, but if you can get the thing, do it. But X-ray is one of the medicine which blindly has given me the thrombocytopenia to come down, to increase. Again, you know the dandruff. Dandruff. I will tell you one more thing. Dandruff, if you get it, if there is a something called scalp analyzer, it just costs you 1,000 rupees. Yeah, you can connect it to a laptop. You can show it to the patients. Where do you have your dandruff more seborrheic dermatitis? Where you have it? Keep it, show it. Laptop, it will be magnified. Patients will be happy. Okay, this is here, this is here, this is here, this is here. Okay, patient is convinced. Give the medicine for 2 or 3 weeks. Ask the patient to report back. Keep it there again. You have a evidence-based treatment, or you can show the results of our homeopathic medicine on the basis of evidence-based. 100% you can give that. Even in the case of psoriasis, if it is a psoriasis capiti, results immediate. You can show it, convince the patient immediate with the. We should use all the gadgets, whatever possible by you. You can use it. I've been telling that there's a weighing machine which gives you all that. You can get more patients with that. So convince the patient. Once the patient is convinced, mouth publicity is something which will bring the fame to homeopathy. I may not be benefiting it, 100 other doctors will be benefiting. Bring out all the evidence as possible. Dysuria. Fabiana. Fabiana is one of the best medicine for the dysuria. Read. Cantharis. Argentum nitricum. Sarsaparilla. Pereira. Pereira, if there is associated with BPH. Petroleum. Clamat is another one medicine. Epigia. It's all been repeating, but I'm putting it into the diagnostic approach level. Difficult, must line. One or 2 or 3 patients came down and said this kid cannot pass urine without lying down. I said, how can it possible? That is a, we get sometimes we don't think that we cannot even correlate. How can a baby lie down and pass? But that is a symptom. Creosote is the medicine. You take out the boric. That is the only medicine. 3-4 cases has helped me. You will not get every cases, but whatever the cases, it remains in our head. Okay. Some patients will come and tell you that the BPH cases or the child, it is like he will have to bend on the back. He will stand bent back. Zingamate. Many patients, doctor, I cannot pass urine in the theaters when people are around. Natramur is the medicine. So dysuria has lot of other things. Then dysuria, however strain, you get very small, feeble streams. Hellebores is the medicine. Frequent desire. You have a frequent desire. Phosphoric acid. You have to think about the diabetes. Again, hellebores, creosote, equisetum, prunus spinosa. Prunus spinosa is also indicated in italics in boric is cough burst at night lying down, where we think about only Drosera, prunus spinosa. Okay, this is one another medicine. Fatty degeneration, another gold mine for homeopaths. And 90% of the scan reports will give you fatty degeneration. Phosphorus, calmag, chelidonium, bryonia, cholesterol, and lot of other medicines. Asking to lifestyle changes, food restrictions, diet restrictions, patient will stick to us. And for 2 or 3 minutes, this ones I just remember is lockjaw, stiffness. Okay. Maybe around 10-12 cases have come on this one, but that one or the 2 cases reminds me in my head. So lockjaw, stiffness comes in. What tells the diagnosis? That is only diagnosis. Cuprum, that is the symptom. It cannot move. Bryonia, cuprum mass, strychnine, belladonna. If it is nerve involved and if it is twitching, strychnine. Nasal polyp is one of the teucrium, lemna, calcarea, tuja, phosphorus, sanguinary. What else you want? And no, nasal polyp is very easy, but the uterine polyp, plumbum met, thalaspi, calendula, fraxinus, phosphorus, and hydro. And I will never forget, I'll be ever gratitude to this plumbum met, because I could help a homeopathic doctor from Delhi, which she never had a faith in homeopathy. 10 years after that, she had a uterine polyp, and the polyp, along with the uterine fibroid, was treated with the plumbum and carcinosin. Now she is doing a MD in psychiatry in Delhi. Vaccines. What else? A senior doctor. That is called mentoring. And she has a total faith in homeopathy. Now she is doing a psychiatry. MD psychiatry. You cannot even believe it. Fibroadenoma, Phytolacca podo, everything, no, hydrasis, asteria. Asteria is one of the best medicine. Asteria can be thought about in a breast tumors in the cancer stage, otherwise also. Harcaria floor, iodine, plumbum, scrofularia, serenum, thyroid. These are the few things, which a lot of other things are there, but today 45 minutes. And little this one. So I'm stopping it here. Thank you. It is totally, I know it is a totally controversial, but for me, nothing is controversial except for my patient. If he feels better, if I can help them out, I just don't care what people talk. For me, patient is that patient and patient, nothing else. Lot of school of thoughts are there. You have to take everything together. My way is little different. Others' ways are different. I take everything. What is making me good, making me happy, making me go to that simillimum. Patient, hold the patient, simillimum will follow. Thank you so much for hearing. Can I stop sharing that?
Okay, sir. Thank you so much, sir. As Rajinikanth saying, "Em vadi tani vadi," likewise Dr. Sada said is saying, "My way is different way." Okay. Anyway, thank you so much, sir. And now it is the time for questionnaire. So if anyone is having questions, you can ask. You can raise your hand. Reza M. Reza Begani.
Sir, ഒരു 10 minute ഞാൻ വിളിക്കാം sir. 10 minute.
Hello, sir.
M. Reza, you
Hello. Yes. Hello, sir. Thank you
Yes.
for your lecture. I want to ask two questions. First, about the dose and reputation. Okay, reputation, the drug in the remedy in the corona. Okay, Q potency. You said about Q.
Okay, sir.
I want to ask about the second about psoriasis. I want to know.
Psoriasis. Okay, first I'll tell you corona.
Yes.
Sir, nothing or 99% of the cases what I have been telling you, I've told you is I've not seen the patient. I've just seen their prescriptions or investigation.
Yes.
So what I was helpless. So what I used to do every 2 hourly, 1 hourly, depending on the situation, I asked, where is she? Where is the patient? They might say me that he is in ICU. Okay, give it every 1 hourly, every 10 minutes, half an hour. So repetition, medicines. Don't ask me because I don't know which potency they have got it. I just tell these are the medicines. I don't know what potency they get it. And later they say after a few days they come, okay, he's out of danger. And I said that then reduce the frequency of medicine. That is the only thing I could help you in that case. Okay.
Okay.
Second thing is psoriasis repetition. Maximum repetition I do is 4 times a day. Maximum.
Yes. No. What's the remedy? You
Remedy is all this that psoriatic medicine, that seborrheic dermatitis medicines will help you. Along with
Yes.
that, your anti-miasmatic, because it's a distraction. So it could be carcinosin or cipilinum. self-destruction, and take out the family history. And if there is any destructive tendency, go for syphilinum or carcinosin. Most of the time, carcinosin and syphilinum comes. At times, medorinum also comes up. So that is one way. Constitution medicines, yes, you will have to give it. That depends upon the taking of the case.
Yes. Thank you, sir.
Thank you, Reza Baigan, and if those, I think there is no one right. If anyone have questions, please raise your hand and you can ask question to Dr. Sada Seth. Tomorrow we will have a class. Dr. Madhusudan, someone, no, only. Okay.
Mohammed Mahmoud Zaidan.
Okay. You can ask questions. I think you can unmute Mahmoud Zaidan. Okay. Okay. Now you can unmute and ask questions.
Audible, please.
Yes, sir.
Audible.
Yes,
yes, sir. Yes, sir.
Thank you, sir. Male with 35 years old and hypertension with creatinine 1.15, upper limit normal. He had stress 15 years ago. What should we give that patient?
So, if you want me to reduce that creatinine level and bring down the BP, eel serum and Solidago will help you out bringing all this. I have the record. I have the record from 9 to normal also. Eel serum potency 3x, 30 or 6 or 30, sir.
Could you repeat it, please?
Eel serum, EEL SCRUM, 6 or 30.
Eel serum.
Eel serum.
Oh.
And Solidago tincture.
Mm.
And if you have that history, go back, talk to him, take the case in detail, you will get something or the thing which will lead to his constitution. But this is an acute, we will have to bring down the creatinine level. So these medicines could help you, sir.
Thank you, sir.
Okay, now Dr. Badran can ask question. Sir, please. I have unmuted you already. Dr. Badran, who come BT?
Oh, Dr. Jayachandran.
Okay, sorry.
Dr. Jayachandran. Doctor, what is your opinion in the case of Fisher and a lady having severe back pain in the rectum, and anus? She can't sit with up to 5 minutes of, and she had a fibroid uterus symptom, fibroid uterus also. What is your opinion in the case of treatment?
The Fisher Mercor will be my first choice. Acid nitricum, Mercor, then Condurago. These three things, if you frequently repeat it and you give a seeds bath with calendula and echinacea or medicines, you can give them seeds bath. Definitely in 1 or 2 hours, it has to come down.
Okay.
Repeat it every 10 minutes, 15 minutes, half an hour, depending on the intensity.
Which potency, sir? Which potency, sir?
Potency, I give 1 m.
Okay. 1 m frequently. 1 hour.
15 minutes, not 1 hour.
15 minutes. 15 minutes.
15 minutes.
Okay. How long we can give it?
So once the pain comes down, then you can reduce the frequency. Then your routine, we have time.
Okay.
Then TDS or QDS or whatever medicines you wanted to bring it down, you can give it, sir.
Okay.
Our first thing is we'll have to control that pain. That's everything can wait. Once the pain is reduced, then the patient is happy. Then take the case or detail or whatever we want to do, we can do it.
Okay. Okay. Thank you, sir.
Thank you, sir. Now, Dr. Abraham Vaidyan can ask question now.
Hello, doctor. Very good, very informative class. For backache, you said that cobalt is a very good survey. Thousands of cases analyzed. So, which potency you are giving, and what's the repetition?
So I suggested, this was when I was a junior, just started my career. We have been what I call enthusiastic and we have been reading it. 1 or 2 cases I gave it to my patient. And they were finding, I was finding little better with the patient. Patient comes and tells me that, okay, I told it to Dr. Jairam. And I just casually, I just told in front of his house, in front of his gate, sir, cobaltum, I got 1 or 2 cases results. Jairam sir, next day onwards, he started for 10-15 days, every patient cobaltum. And after 10-15-20 days, he is calling me up and telling cobaltum 30 is he even told it in front of the 700 people audience in IHK state seminar. So it's one of the best medicines. Cobaltum is one of the best medicine even for coccydynia. Coccydynia, one of the specific medicines was sacrum painful.
Okay.
Okay, along with that, there is a cushion, we get it now. If you if
So,
the patient has chronic cases of coccydynia, online we get a cushion with this one. So order for that
one more
also, it
question.
can help you. Yes, sir.
One more question, doctor. For gallbladder stone, Thion are using Thion that's getting result. Diascoria, which potency and in first stage or intercurrent?
Diascoria, tinger.
Tinger.
Yes, sir.
Intercurrently or first medicine?
Regular medicine. If there is a pain of the shoulder also, if there is a pain in the shoulder, back of the shoulder, that is 100% you give Diascoria. You can get results.
Okay. Okay, thank you. Thank you very much.
Thank you, sir. And Dr. Harihan also raised hand. And now I think it is that after him, we can move to the Malayalam session. Tomorrow, Dr. Madhusudana Panikkar is going to take the classes for English session about the parenchymal kidney diseases. Now, Dr. can ask question. Okay.
Some unmuted, some.
Okay. Now you can unmute and talk.
Okay, it is unmuted. Okay, Dr. Sada said your class is nice and wonderful. It is pathologically based. Say along with the constitutional medicine, no, or any classical prescription, we can use this organometric medicines also. Then we will get a good result. It is a supporting method. Supporting methods. One of my question is, have you treated any case of prolapse of this disc prolapse? What you have, which is the protocol which is you are using?
The protocol of disc prolapses, you use a belt. Along with that, our medicines depending upon the symptom and the pathology. I have a tendency. I have a knowledge on chiropractic.
Knowledge of
chiropractic. Chiropractic, we call it as chiropractic. You put the bone properly.
What is the medicine regarding that?
Medicine is Goyacum, Bryonia, Ruta.
Okay,
same.
doctor. Okay.
Okay, thank you everyone. Now we are going to wind up the English session and I am handovering to Dr. Danish for conducting Malayalam session. Dr. Danish, welcome.